piece of work I'm most proud of is something that I'm doing at the moment, and that's with a contract around a particularly exciting piece of work which combines mental health and learning disability and complex individuals who are suffering from both. And I think it's interesting because I think it's a very, if you want to talk about vulnerable people with both mental health difficulties and learning disabilities, they don't have a lot of self-advocacy. And so being able to step in, get that done, get the project moving, get that working, provide that support, brilliant. That makes me happy.
Throughout my role here, many of the projects we work on have patients at the heart of them. So they're the main, within the benefits, that's what you look for, is what matters to the patient.
So I've worked on a mental health project in the Southwest looking at competency frameworks for the mental health workforce. I think that really benefits patients by actually making sure that we've got a really skilled set of practitioners and people in the mental health workforce that can give their best to patients.
My work benefits patients a lot on a national level, I think. So we get quite involved in recruitment campaigns and helping to ensure that the medical professionals are in the NHS and where they need to be to support the patients.
I think it benefits patients in lots of different ways, but one particular piece of work I've been involved in is to do with mental health, and I've done a lot around recruitment and retention for that, which I feel really impacts on patients.
During my first year of the scheme, I was fortunate enough to get a promotion within my team, so I'm now a junior consultant, but I'm still retaining being on the graduate scheme and kind of getting the benefits to go with that. It was basically very similar to what I was doing previously when I first joined as a graduate, but a slightly more, bigger step up, so I've got more, I suppose, responsibilities and leadership within the team now. But it's also really nice that, although being relatively new to the team, that they sort of hopefully kind of valued my hard work, and it's nice that they gave me the opportunity to then take the next step, really.
Most of my development's been through sort of practical experience, through developing my skills, capabilities and experience through projects and programmes that I've worked on. And then my other sort of development's been more formal qualifications, so Prince 2 practitioner I took sort of at the beginning of my first year, and then moving on to the Mary Seacole programme, which is part of the NHS Leadership Academy. Both really interesting opportunities and really exciting. I think the consultancy offer and the way the team works really helps graduates develop into their roles. So you have sort of like a supported learning throughout the programme.
In lots of different ways, in ways I never really expected, to be honest. So I've had lots of different exposure to different teams across the business due to the nature of my work. And I've really noticed the kind of progression in the fields that I was interested in as well. The organisation's been really nice at promoting actually people's interests and gives you opportunities to get involved in areas of interest. So mine's been mental health. So I've managed to progress my career in different networks as well.
Almost had too much support. I was talking to someone else recently and they were saying, so I've got my line manager, I've got a careers manager, I've got pastoral support, I've got a mentor, and I've got some kind of other contacts, and people who just seem to have taken a shine to me and just kind of meet up with me fairly regularly. And it kind of means that it's there's loads of people there all providing kind of very varied support and lots of different things. It's really great.
Probably the variation, because there's so much to do, so many different projects, and yeah, there's anything you want to be involved in, you can be.
I think my favourite thing about working with us is that no day is the same. I get lots of different projects every day with different tasks, so it's not your typical 9-to-5 job, and you also get a lot of support and opportunities for career development, which you wouldn't have without this graduate scheme.
I think it's just a fantastic opportunity. I think every day is different. It's really exciting. I love my job here, and I know lots of the other grads do. I think there's so much experience in SCW. There's lots of people that can help support you on your journey, and they've been through lots of stages that we have in our careers. So lots of people who want to help mentor you through the learning and experience that you get here.
The management team are very keen to give us exposure and to put us in situations where sometimes we may feel a little bit out of our depth, but equally there's always a safety net there as well. So if you're looking for something where you are genuinely making a difference, and also at the same time you're being given constantly new challenges and not just perhaps kind of the more mundane tasks. I would definitely recommend that's why you should apply for the graduate scheme.
I think as an organisation and as a graduate scheme, we've got a really good culture going on. We have a set of organisational values that I think really underpins how we expect to be treated in an organisation. I've just found it to be incredibly supportive, challenging, everything I kind of expected from a grad scheme and a lot more. I think you will have so many opportunities, and it's a very different culture of a grad scheme than other grad schemes usually are. You don't have that competitive nature. People really want you to succeed here, and they will really help you too.
I think it's a graduate scheme not really like any other, and it gives you sort of the opportunity to be involved in the NHS, which is obviously a great organisation, and specifically work with different other NHS organisations as well.
I think because it's a really friendly environment, and you get a chance to learn as you're going along, so you're doing your role whilst gaining qualifications, whilst getting the practical experience and the support of people who are really successful in their career. So I think it's a really worthwhile scheme to apply for.
I think it's because they might get it. So I actually emailed and contacted and said, I'm not sure if this is for me, I'm not sure if I qualify, I'm not sure if this, and I read through it and I was like, you know what? There's lots of things I'm not sure about, but when it says like, is this for you? Is this the kind of person you are? I thought, yes, that's the kind of person I am. That's the kind of job I want to do. And so I applied just because I thought, why not? And it turned out I get it and I'm quite enjoying it.